Hey everyone, my name is Lindsay. I am an outpatient oncology dietitian at Amita St. Joseph Hospital in Chicago. We are a small community hospital in the big city, and our partnership with American Cancer Society allows us to provide services for our patients on par with the bigger university-based hospitals here in the city. So we are so grateful for our partnership with them and for all the services that they help provide. And so in turn, we are super grateful to you, for all of you who have decided to spend your time raising funds and running and just being cheerleaders in general for American Cancer Society, because their programming really does do so much to help the community. Everyone knows that American Cancer Society is working to educate about cancer and to try to help fund research to end cancer, but most people don't know that there's also a lot of everyday groundwork that's going on that really just helps make cancer patients' lives better. And as a small center, like I said, we are able to take advantage of all of those services, things like transportation to and from treatment for our patients. ACS can provide transportation vouchers or CTA passes, things like wigs and head coverings for folks who've lost their hair during chemotherapy. There is a program called Reach to Recovery, which partners patients with like a mentor going through or having gone through something very similar to them. ACS volunteers, we have on-site volunteers with ACS who come to meetings. They help us maintain our accreditation because there are things that we could not physically do without them. Our staff and specifically, they're like family to us. They are so helpful. They sit in on our board meetings. We have a patient advisory board who talks about ways to improve the patient experience and things that are going on at the cancer center in real time. And we have an ACS representative who sits in on those meetings and thinks about ways that ACS can help partner with us to address any of those needs. They have baked goods for our bake sales. They've thrown bingo parties for our patients. They come to all of our Survivor Day events, celebrating those who have survived and are now thriving after a cancer diagnosis. We do that every year. So they also provide a library of really amazing, really professionally, beautifully done print education materials that we could never afford or even have the manpower to create. And they help educate patients on everything from what does a cancer diagnosis mean, what sort of resources are available for me, what do I do, like what about fatigue and nausea and depression and financial distress. So there's this library of resources available in about a dozen languages, which is amazing. And now in the midst of the pandemic that we're currently experiencing, ACS has really continued to work hard. They've changed what they're doing, but they are still supporting us in a very real way. We've had volunteers create masks and face masks for our staff and our patients. They have organized deliveries of fresh, nutritious foods for patients who are super at risk for malnutrition in general. But especially now when it's not advised to go to the supermarket or have deliveries brought in, they have provided us with meals to give to our patients and some non-perishables and snacks and things for them to keep. And even a delivery of these amazing socks that are super supportive. They just kind of like hug your feet. They're awesome. Perfect for patients, but especially for our staff who are on their feet and running around, 8, 10, 12 hours a day. So they've been super generous. They're always thinking of ways to continue to help us even as the circumstances are changing, and they're all hard at work from their homes. So we appreciate it. And we certainly appreciate you guys for your contribution. And we know that there are a ton of charities out there, and we really appreciate that you are choosing to donate your time and your money and your resources to American Cancer Society, because they are really doing great things throughout the country. So, just one last thing, that despite being such a huge organization, they really do treat their hospital partners like family. A super special shout out to our on the ground partners, Jess and Kelly, and the walk and event committees Jenna and Heather and the rest of the team. There's some new people, and Jess, who coordinates everything for Jessica, who coordinates everything for team determination. So thank you guys. Hopefully one day you'll all be running together again as a team, and we will cheer for you as you guys are supporting for us. So thanks. Keep up the good work. Stay healthy, and we really appreciate you.